Now we're going to begin the urinary system. Here's an anterior view of the urinary system. You see the kidney, and that produces urine. The ureter transports the urine toward the urinary bladder. You see the urinary bladder, it's a temporary storage area for the urine prior to elimination. And then you see the urethra, it conducts the urine to the exterior world. In males, it transports semen as well. There are three functions of the urinary system. The first is excretion, the removal of organic waste from body fluids. Elimination, the discharge of the waste products. And number three, homeostatic regulation of the blood plasma volume and solute concentration. Now let's go over the functions of the urinary system. First, we have the kidneys. That's the primary organ. It's the organ that produces urine. Then we have the urinary tract, and that's the organs that eliminate urine. The ureters are paired tubes, the urinary bladder is a muscular sac, and the urethra is an exit tube. And then urination or micturition is the process of eliminating urine. It's the contraction of the muscular urinary bladder that forces urine through the urethra out of the body. The homeostatic functions of the urinary system include two things. Number one, it regulates blood volume and blood pressure. It does that by adjusting the volume of water lost in urine and releasing erythropoietin and renin. That's how we make red blood cells or increase red blood cell production. It also regulates plasma ion concentrations. That includes sodium, potassium, and chloride ions by controlling the quantities lost in urine, and also calcium ion levels through the synthesis of calcitriol. It also helps stabilize the blood pH level by controlling the loss of hydrogen ions and bicarbonate ions in urine. It also helps conserve valuable nutrients by preventing the excretion while excreting the organic waste products, basically filtering the valuable nutrients out and allowing the waste products to leave. And it also assists the liver in detoxifying poisons. The kidneys are located on either side of the vertebral column. The left kidney lies superior to the right kidney. The superior surface is capped by the adrenal gland. The position is maintained by the overlaying peritoneum, contact with the adjacent visceral organs, and the supportive connective tissues. This image shows you the position of the kidneys in the body. A typical adult kidney is about 10 centimeters long, about 50.5 centimeters wide, about 3 centimeters thick, or about 4 inches, that would be 4 inches long, about 2.2 inches wide, and about 1.2 inches thick. And it weighs about 150 grams or about 5.25 ounces. The hilum is the point of entry for the renal artery and the renal nerves, and the point of exit for the renal vein and the ureter. Here the hilum is pictured. Again, we see the hilum pictured again with the ureter and the renal columns. The nephrons are the microscopic tubular structures in the cortex of each renal lobe. This is where urine production begins. The kidneys receive about 20 to 25% of the total cardiac output. It's about 1,200 milliliters of blood flows through the kidneys each minute. The kidney receives blood through the renal artery. Filtration occurs in the renal corpuscle. Blood pressure forces water and dissolved solutes out of the glomerular capillaries into the capsular space. This produces a protein-free solution, a filtrate, similar to blood plasma. The goal of urine production is to maintain homeostasis by regulating volume and composition of blood, including the excretion of metabolic waste products. There are 3 organic waste products: urea, creatine, and uric acid. Organic waste products are dissolved in the bloodstream, are eliminated only while dissolved in urine, and removal is accompanied by water loss. The process of urine formation has 3 steps: filtration, reabsorption, and secretion. Reabsorption and secretion starts at the kidneys and it involves diffusion, osmosis, channel-mediated diffusion, and carrier-mediated transport. Now let's cover acidosis. There are two types that we'll encounter. Lactic acidosis, that can develop after exhaustive muscular activity, or ketoacidosis, and that can develop in starvation or diabetes mellitus. A healthy adult produces about 1,200 milliliters of urine a day, with an osmotic concentration of about 800 to 1,000 mOSml per liter. Diuresis. That's the elimination of urine. Typically, it indicates the production of large volumes of urine. Diuretics are drugs that promote water loss in urine. Diuretic therapy reduces blood volume, blood pressure, and extracellular fluid volume. Now let's talk about the composition of normal urine. A urine sample depends on the osmotic movement of water across the walls of the tubules and collecting ducts. Normally, it tends to be a clear, sterile solution. If it has a yellow color, it's a pigment of urobilin. It's generated in the kidneys from the urobilinogens. Urinalysis is the analysis of a urine sample, and it's a very important diagnostic tool for doctors. Dark urine means dehydration, and that's not good. The ureters are a pair of muscular tubes. They extend from the kidneys to the urinary bladder. They begin at the renal pelvis. They pass over the psoas major muscles, and they penetrate the posterior wall of the urinary bladder. The urethral openings are slit-like rather than rounded. This shape helps prevent backflow of urine when the urinary bladder contracts. Here the ureters are pictured. You can see they go from the kidney to the urinary bladder. We can all see the cross-sectional view of the ureter. Now let's go over the urinary bladder. It's a hollow muscular organ, and it functions as a temporary reservoir for urine storage. A full bladder can hold as much as 1 liter of urine. Bladder position is stabilized by several peritoneal folds. There's the posterior, inferior, and anterior surfaces. They lie outside the peritoneal cavity. Ligamentous bands anchor the urinary bladder to the pelvic and pubic bones. Here we see the peritoneum and the urinary bladder and the pubic symphysis and how the bladder is anchored. And here we're looking at the male anatomy. Now we're going to compare and contrast the female anatomy. Again, we see the uterus, we see the urinary bladder, we see it anchored between the peritoneum and also the pubic symphysis. The urethra extends from the neck of the urinary bladder to the exterior of the body. The male urethra extends from the neck of the urinary bladder to the tip of the penis. It can be about 18 to 20 centimeters or 7 to 8 inches. The prostatic urethra passes through the center of the prostate gland. The membranous urethra includes a short segment that penetrates through the urogenital diaphragm, and the spongy urethra is the penile urethra and extends from the urogenital diaphragm to the external urethral orifice. In contrast, the female urethra is very short. It's 3 to 5 centimeters or 1 to 2 inches. It extends from the bladder to the vestibule. The external urethral orifice is near the anterior wall of the vagina. Let's talk about the external urethral sphincter. In both sexes, it's a circular band of skeletal muscle. It's where the urethra passes through the urogenital diaphragm. It acts as a valve. It has a resting muscle tone, and a voluntary relaxation permits micturition. The micturition reflex in urination begins when the stretch receptors stimulate the parasympathetic preganglionic motor neurons, and when the volume is greater than 500 milliliters, it triggers the micturition reflex. In infants, they lack voluntary control over urination. Incontinence is the inability to control urination voluntarily. This may be caused by trauma to the internal or external urethral sphincter. Now let's begin with age-related changes. As a person ages, there's a decline in the number of functional nephrons. There's a reduction in GFR. There's also reduced sensitivity to ADH, antidiuretic hormone. And there are problems with micturition reflex. The sphincter muscles lose tone, leading to incontinence. There's a control of micturition can be lost due to a stroke, Alzheimer's disease, and other central nervous system problems. In males, urinary retention may develop if the enlarged prostate gland compresses the urethra and restricts urine flow. Now let's talk about the excretory system. This includes all systems with excretory functions that affect body fluid composition. They include the urinary system, the integumentary system due to sweating, the respiratory system due to breathing, and the digestive system due to excretion. And this just shows you the interconnected workings and the interdependency of all the systems and how the urinary system affects all the other systems of the body.